Thank you all for joining us. I think I know many of you, but I'm Monica Beaulieu. I'm one of the nephrologists at St. Paul's Hospital in Vancouver and chair the CKD Clinic Network, and very privileged to do so. This is a special edition of the CKD Clinic Network where we're going to talk about the reflections from a World Café we had a few months ago. So I'll go to the next slide and just reflect first that I am currently on the traditional, ancestral, and unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh people. And I am here with gratitude. If I'm sure you're on many different lands. If any of you can pop it in the chat, please feel free to do so. And for those of you that can still see my background is a new hospital that's coming. It's one of the biggest new hospitals in Canada, and it's the new St. Paul's Hospital. And as part of that, there is an Indigenous wellness, a welcoming center that's just beautiful, and a medicine garden. And as part of creating that medicine garden, I got to work with an Indigenous ethnobotanist. And I love gardening, and just hearing from the ethnobotanist about the plant medicines in my local area has been very wonderful for me. So any of you interested in gardening, there are individuals out there that will help you learn the local Indigenous plant medicine. Today, I would like to introduce the speakers for the session. Dr. Matt James, I'd like to introduce. And Matt, if you Google Dr. Matt James, AI puts you first. I'm sure there's many Matt James in the world, but you're number one. So that is probably all the welcome you need. But I've known Matt for a long time. Matt is a professor and clinician scientist at the Cummings School of Medicine in Calgary. He has a very accomplished research career, but for this group has been very involved in CanSolve CKD, both in research and leadership roles, who will speak to us. And Selina, I didn't Google you. I'm sorry. So I don't know where you come up, but your name's a bit more unique. Selina Allu is a knowledge translation broker and implementation support practitioner in the Division of Nephrology at the University of Calgary and CanSolve CKD. And she's been my right-hand person co-leading the CKD Clinic Network since inception. Also on the call, I see Mila Tang, who was the very inspiring co-host of the World Café and did a wonderful job. And many of you were at the World Café, so thank you for trusting the process and participating so well. Next slide. I also want to introduce Candice Ramjan. Candice is a graphic recorder and knowledge mobilization coordinator with the Alberta Spore Support Unit's Learning Health System team. And she's going to be listening in on the discussion today, and she's going to be visually capturing this meeting, and then she's going to be sharing with us the graphic recording of what she has heard from the session. So I'm very excited to see that. And welcome to you, Candice. So just a very brief background, the CKD Clinic Network has been around for almost 16 years. And initially we started as part of a knowledge translation project to determine best models of care in CKD clinics. We did a survey and figured out what everyone was doing and what the state of CKD clinic models were. And since that time, when we first started, there were a lot of frontline CKD clinic staff. So those of us that work in CKD clinics. And on reflection, we now have such a robust group of patients, of caregivers, of researchers, decision makers, and more. And so it's a very timely, time to start to reflect on what we can be most impactful for the patients that we serve. We have done things like share best practices, policies, models of care. We have worked to coordinate linkages to national organizations. The goal was to disseminate the tools and resources that all of you are creating to other healthcare providers so we don't recreate the wheel in patients. And we've been quite successful in offering members the opportunity to participate in research, mainly by trying to bring people together by disseminating surveys, by offering letters of support to funding bodies, and through collaboration and partnerships. Next slide. We offer on an ongoing basis, for those of you that haven't shared your work quarterly virtual education sessions, and thanks to all of you who have participated. It does provide an access to a network of peers and experts in the non-dialysis CKD clinic sphere. There is an opportunity for collaborative research and knowledge translation, and there's more of an opportunity than we've been doing, and I think that's some of the impetus for the discussion today. There's the opportunity to leverage those connections with different national and regional groups, and really fundamentally a commitment to shared learning and action, and to do that in a very purposeful and effective way. Next slide. So today we're looking at the future of the network and trying to take a pause. And I think we often don't do this as often as we should when we're so busy in the day. So I'm really, really thankful to Matt and Selina and others who have done this in such a coordinated way. There's so many different questions. When we first started the network, it was like, okay, models of care are different. Let's figure out how to standardize those. Funding's different. Let's figure out how to standardize those. Networks have different QI measures or indicators. Let's figure out how to work together on those. And those are very inspirational and aspirational goals. And it's time here just to really reflect and say, what is the potential right now to reimagine in the network with where we are in nephrology, which has also changed a lot since 2013, thankfully. So with that, I hope that provides a tiny bit of a background, and I will pass it over. I think, Selina, you're going to start off talking about the cafe.
Thanks, Monica. So our story actually began last year around this time. We received a grant to begin exploring how our CKD Clinic network could grow and evolve. As part of this initiative, we planned 4 activities. We started with a member survey and then shared the results with the network in April, and those results were sent to you as part of this invitation. And then this was followed by an in-person World Café session in May. So today we're going to share the reflections from that session. And more importantly, we'd love to hear your thoughts on where do you think we need to go together as a community. So the purpose of the World Café session was simple. We wanted to bring people together for meaningful conversation.
Sorry.
No problem.
No.
We just have one to mute, I think, Drew.
I got it. Thank you. So what we wanted to do was to bring people together to understand what matters most to our kidney community, and then to together explore some bold steps to reimagine a new path forward. What can we do to evolve together? The slide you see here reflects what we hope to create during the World Café session. It wasn't just about problem solving. It was about making space for meaningful dialogue across diverse experiences and roles. You'll notice at number 4, we have an emphasis there on where there's energy in the system. And that was deliberate. We weren't trying to solve everything in one afternoon. We wanted to find areas of shared interest, of curiosity, and commitment that we could build on. We also wanted the World Café to be one about building relationships. We invited 40 people to the CKD from our CKD Clinic Network. These individuals were initially part of the grant and were also familiar with the topic and work of the network. As you can see in this invitation, we intentionally named our session as Transformative Conversations World Café to highlight our purpose. We welcomed 19 participants on the actual day, which took place on a Tuesday afternoon at the Sheraton Hotel in Vancouver. In addition to the 19 participants, we had a hosting team that included myself and Mila Tang, who were co-hosts. We were supported by Isabella Varela from CanSolve CKD, who captured detailed notes, and she also took photographs during the session, and Miranda Maslany, who documented the conversation through live graphic recording. We wanted our World Café participants to really think big, to imagine bold possibilities, and help share a vision for the future of the network. As you can see from the 19 people that attended, the gender balance was slightly the gender balance leaned slightly towards female participation. But what really stood out was the diversity of professional backgrounds represented in the room. The largest group were nephrologists, but equally important were the perspectives brought by our patient partners, a diverse research community, allied healthcare professionals, administrators, and organization representatives. The mix created a truly interdisciplinary space where care delivery, lived experience, and system-level insights came together. So here's a quick snapshot of the agenda we used to guide the World Café session. We had a much more detailed version that we used kind of behind the scenes, but what you see here captures the flow of the day. Most of our time was devoted to 2 rounds of small group conversation, followed by a gallery walk, group reflections, and then finally a closing sharing circle. From time immemorial, new ideas and social innovations have been sparked through informal conversations in public spaces, in cafes, courtyards, and community halls. So the World Café draws from this timeless tradition. It is not a new technique. At its core, the World Café rests on 2 simple but powerful beliefs. One, that people have an innate desire to talk about things that matter, and these conversations give our lives meaning and purpose. And secondly, when we talk together, we access a collective wisdom. The World Café method has been around for about 30 years, and it draws from traditions like participatory action research and appreciative inquiry. It is a simple method for engaging people in conversations that matter, using small group dialogue and rotating rounds of discussion. It's a method that works really well in complex systems where there isn't a single answer to a problem, just a web of lived experience, ideas, and questions that need to be explored together. We chose this method because we also wanted to do something different from a structured session aimed at reaching a predefined endpoint. So this was a perfect method to bring our CKD community together to generate fresh thinking and some collective insights. The World Café method is rooted in 7 core design principles that you see here, and 10 guidelines that I will refer to later that have been developed by the World Café global community. And when they're used together, they create the ideal conditions. So let me walk you briefly through how we brought each of these 7 principles to life during our World Café session. So the first and most important thing is to clarify the context. And we did this by framing our shared purpose in the invitation that we sent to our participants and at the start of the session. We created a hospitable and welcoming space, from greeting each person at the door to the circular table layout that invited connection. And we also did a group check-in. We explored questions that matter. Each round was guided by carefully chosen open-ended questions. By rotating tables between rounds, we encouraged everyone's contributions and we created spaces for all voices. Participants moved between tables, intentionally mixing roles and perspectives. This cross-pollination allowed fresh thinking to emerge and prevented siloed conversations, thus allowing us to connect diverse perspectives. We listened together for insight. Listening at this session was active and intentional. Each table engaged in rich conversations, followed by a mini harvest where ideas were shared aloud, and we practiced collective sense-making through pattern spotting. And finally, we shared collective discoveries in a graphic summary and a full group report of what we had learned together. So in this picture, you can see Matt up front, welcoming participants and setting the stage by sharing our purpose and the context for our gathering. Here's Mila setting the tone by reviewing the World Café principles and inviting people or our participants to approach the session with presence, with curiosity, and a spirit of sharing. So alongside the 7 design principles that I just spoke of, the World Café also offers a set of simple guidelines or group agreements to help participants show up with intention. And used together, they can help people feel comfortable to speak, to listen, and to contribute. As co-hosts, Mila and I spent some time on this, inviting our participants to focus on things that matter, to speak from the heart, to really listen to understand. We encourage people to also slow down and reflect. And yes, we also ask them to doodle, to play, and have fun. These small agreements help transform the room from just a meeting into a meaningful conversation. Each table was equipped with an agenda, the 2 questions on large index cards. We provided markers, color pencils, and other creative tools in addition to post-it notes and notepads. Basically, we wanted our participants to write, to doodle, to draw key ideas and on post-it notes and share them. I was just at a session earlier with a psychologist who was talking about one of the ways we can help relieve stress in our lives. And she said that doodling in meetings was really important because when we use our hands, it helps us to get the mind moving, right? So it's kind of like social play, and it goes beyond just brainstorming and just writing ideas. The World Cafe method was actually new to most of the participants at the session. So it was really important that we explained the process at the start to create trust and to ease people into the method. So this is what our process looked like. We set up the room cafe style, 5 tables of 4 people each. In round 1, participants sat with people they didn't know and then discussed the first question for about 20 minutes. At the end of the 20 minutes, each table got 3 minutes to provide a mini table report and share their highlights with the big group. And then after a break, the second round of questions began. And we encourage everyone to move to another new table and meet new people. They got 20 minutes to discuss the second question and then had a mini harvest, etc. So that's kind of the process we had. The movement between tables helped ideas spread and to build. And I think this is what makes the World Cafe so powerful. It's not just about what's said at one table, but how ideas travel, evolve, and connect across the room. How did we identify the big questions that we were going to ask at the session? Well, we wanted to find questions that could help us explore things together. Both questions were designed not to diagnose problems, but to surface what's working and what's possible. In our first round, we asked, what unique strengths and added value for research can a CKD Clinic Network provide in Canada? This question was an entry point, a way to reinforce what already works, to encourage everyone's contributions, and to start connecting across roles and lived experience. It helped us begin with a foundation of strength and alignment. Before we can design a bold future, we need to know what is worth preserving and amplifying. In the second round, we moved to envisioning what's next. We asked participants, what bold steps are needed to co-create a responsive platform that supports evidence-based informed care in CKD clinics? This question was provocative by design. It's an invitation to dream, to think beyond constraints, and to imagine what could transform kidney care in Canada. Here, we're seeking aspirational statements of intent and action. In this round, the energy in the room shifted. People began to stretch their imagination, to challenge assumptions, and articulate what the future might look like. So all these ideas were evolving, people were writing notes. So we used an intentional process to collect these ideas being shared during the World Café. At the end of each round, participants wrote their kind of aha insights on post-it notes and then placed them either on an idea wall or they handed them directly to the graphic recorder. And this helped us capture ideas in real time. Sticky notes were then sorted on the idea wall, basically ideas that aligned with strengths and ideas that pointed towards a bold future. And then in the third part that you see here, participants were encouraged to visit the idea wall as well as the graphic illustration throughout the meeting. They got to engage with what others had already shared. They added comments. They used dot stickers to highlight important ideas. This helped us to identify early signals of energy and priority areas that were emerging from the group. So this is what the kind of a zoomed in version of the idea wall, and you can see these insights and on post-it notes. The notes reflected anything that felt meaningful, surprising, or that were worth building on. And you can also see the dot stickers that were placed next to important ideas. Here's one of the tables, deep in conversation during the session, and the same table reporting back. So like I'd said earlier, each of the groups had an opportunity to share highlights with the full group during the mini harvests between the two rounds. In this photograph, you see the idea wall starting to take shape. Mila and I are trying to sort through the post-it notes and cluster them into ideas and themes. While conversations were unfolding, Miranda, our graphic illustrator, translated the dialogue into visuals in real time. And this is actually what Candice is going to be doing right now. She captured words, ideas, and emotions, creating a living summary of the discussion as it was unfolding and happening. By organizing and visualizing the ideas on the spot, Miranda helped everyone see the connections that were starting to form. This process also made people's contributions visible. We could literally see our insights taking shape on the wall and becoming part of a bigger collective story. During breaks, participants were encouraged to engage with the ideas taking shape on the illustration wall. In this picture, you see Matt adding a dot to emphasize the importance of a particular idea that is being developed. The interaction between the participants and the graphic illustrator made this process truly dynamic. Ideas didn't just stay on the sticky notes or in conversations, they evolved visibly on this wall. What's also powerful about this photograph is what's happening alongside. Here you see our patient partner, Manuel Escoto, and nephrologist Aminu Bello in active conversation. This is a really good example of how World Cafes create moments of connection across roles. To close the World Cafe, we invited everyone to a final reflection circle using the head, heart, and hand framework. So this was Mila's idea, and it worked really well. We asked each person to share one takeaway at the end, something that stayed with them in their head, an idea, in their heart, a feeling, or in their hands, an action that they wanted to carry forward. So as each person spoke, they held a ball of yarn, and then they tossed it to someone who had not spoken yet. This way, we started to create this visible web of connection across the room. And it was a really powerful metaphor of weaving ideas together and surfacing things that we were learning together. I think this picture beautifully captures our closing circle. A web of individual reflections that were shared aloud and passed from person to person. So each of those threads that you see represents a voice, an idea, or a commitment to carry something forward. And again, this is another powerful metaphor for our network. I think we are a network that is connected, that is collaborative, and yes, full of potential. And this is what the final graphic illustration looked like. It captured both the emerging ideas as well as the energy in the room. Miranda has very skillfully used color, layout, and visual metaphors to reflect the core insights from the conversations. So if you look at this illustration, on the left, you'll see concepts in green, and those ideas emerge from the first question that we asked. On the left in purple are those ideas and conversations that emerged from the second question. And I think this is a very effective way to visually track the evolution of the conversations at the World Café from strengths to bold steps. So how do we make sense of all this data we had collected, right? Over the course of follow-up meetings into, I think it was like in May and June, our hosting team came together several times and we started to reflect on everything that we had collected. We used a layered process. First, sorting and theming the sticky notes, and then reviewing the written table notes, and finally using the note taker summary and the graphic illustration to cross-reference what we heard and what stood out. One of the more surprisingly effective tools that we used is the Post-it app. I'm not sure how many of you are familiar with this, but basically what you do is you take a photograph of the sticky notes that were on the wall using the app, which then instantly digitizes them. You then import the images into PowerPoint where you can now move them into clusters. This helped us to organize our notes a lot better, spot patterns, and to translate these insights into emerging themes. This is basically what it looked like. The image on the left is kind of, all the sticky notes that were not organized. And then when we started to move them around, you sort of see these two clusters that were starting to form based on question 1 and question 2. This layered process that we used isn't what one would call traditional data analysis. It's about surfacing collective meaning and looking for patterns through connection and conversation. In the report that you received as part of this invitation, we expand on this in a little more detail, but here were some of the key insights that participants recognized, right? These are some of the network strengths. Trusted relationships, integrating patient perspectives, supportive infrastructures. Taken together, these reflections affirm that the CKD Clinic Network is valued, trusted, and a collaborative learning community that supports real improvements in kidney care. For our second question, we were able to surface some bold steps and opportunities for what our network could be and where we could go next. Participants felt that we need to evolve from a space of discussion to one that drives action, has shared learning, and one that is accountable. And together, I think these ideas reflect an ambition and a desire to move the CKD Clinic Network from insight to impact. When we looked at everything that was starting to emerge and what we had heard, a clear pattern started to emerge. The future direction envisioned strongly aligned with the principles of a learning health system. And the graphic that you see is a first attempt to sort of illustrate that connection. A learning health system is one that continuously learns and evolves by integrating research, data, and lived experience. And it does so in real time with equity at its core. We go into more detail in the report, but today I simply wanted to plant the seed that this could be the organizing vision for how our network might evolve, and perhaps a powerful framework to guide future strategic planning. To close my section, I want to highlight the people at the heart of this work. In this photograph, you see our incredible patient partners, Manuel, Kate, and Kathy. Many of you who participate in the World Café are also here today, and you can probably speak to your experience far better than I can. But I'd like to leave you with this reflection from Kathy, which I think beautifully captures the spirit of the session. And on that note, I will turn it over to Matt, who will walk us through the key recommendations and some possible next steps.
Thank you, Selina, for all of that. I want to just, before I move on to sort of this next steps and opening it up for further discussion, I really do want to thank everybody who participated in the World Cafe event and really did so with a lot of openness and sharing and enthusiasm. So it was a wonderful event. It's the first time I've participated in a World Cafe, and it was a thoroughly enjoyable experience, and it was really interesting to see what's come out of it. So thanks for all the participants. I also just really want to thank, sorry, go back, Selina, the CanSolve CKD team who helped organize and operationalize it. Isabella and Tara did a lot of work behind the scenes to make that happen. So thank you to them. Also, the Canadian Society of Nephrology meeting was happening. This was done in coordination, and their operation team was very good in helping us with a venue and working around the pre-meeting events to hold this in conjunction. Behind the scenes, some of our group here in Calgary, Sarah Gill and Pantea Javaheri, did a lot of behind the scenes support and work. So we could also I think we have this included as a research project with ethics approval, if I remember correctly, but they made that happen for us. So thank you for that. Selina showed the work that Miranda did with those really beautiful illustrations to convey, and I can see from today how effective that can be as a way to convey what we did in that time to people who weren't able to be there. So thank you to Miranda and her team. And then also to Mo and Monica, for a lot of insight and thought that went into developing this event, putting it on. Your ideas were really instrumental in this, and Monica also just for your leadership and sustaining the CKD Clinic Network over the years has been fantastic. But a real big thank you, Selina and Mile, for really making this happen, this event in all that you did to make it really successful and meaningful. I think it was really, really helpful. So really, particularly thank you to you both. But onwards, now you can advance that slide. Thanks. So we want to kind of, I don't want to talk too much because we do want to open it up and have some time for discussion around where do we go from here. We've tried to develop some ideas and include them in our report based on what we heard and the synthesis of all the data that Selina showed from those post-it notes and the illustrations and the conversations. I appreciate that Zoom meetings are not the best way for this to happen, but hopefully people will feel comfortable sharing their thoughts in a moment because we see this as not quite closed yet on input. We have a lot of a very meaningful conversation that came out of the World Cafe, but we're very willing to hear more and keep this conversation going as we are putting together a report, as Selina mentioned. So this is kind of one more opportunity to see if there is more here that people would like to add into this phase of the work before we kind of really move into implementing the ideas and some of the recommendations that come out of this. So we're very much want more input if people have it. We'll go to the next slide. I think Selina's really covered a lot of what we heard already, but in the end, our report has 7 recommendations in total and ideas for moving forward, but really these are the 6 larger categories within which those recommendations will sit, we think. So just to try to put them together, one is that this is intended, this is the blue bar at the top of the at the top here. We're trying to be something that is represents clinics and coming together across the country, across Canada. And so we realize we will need to figure how we work within provincial healthcare delivery and national strategies and improvement efforts. So one of our recommendations is to figure out, how we fit into these existing provincial, national objectives and infrastructure in our work. But we really would like to kind of go beyond our federal, fragmented model and maintain, the original idea in this network was to be a national countrywide initiative. Kind of moving down here, we have a lot of progress made in patient engagement and involvement. We'd like to see that continue and even be strengthened, integrated more through our network and potentially into the CKD clinics where we could operationalize efforts. Moving kind of second row over to the right, one big common theme that came up, and I heard in discussions myself, was some enthusiasm around trying to do something coordinated around data collection or measurement. That's always, being very, again, fragmented at provincial levels, but maybe there were some work we could start to do to see if we can measure or collect data in common ways. And so there might be some particular work that we could do that helps to enable us to measure consistently across different areas. And then moving down to the last row, this network has really had a history of being very good in promoting knowledge exchange and sharing. And so we didn't want to lose that. We really wanted, I think, to continue that aspect of things and even grow and strengthen it. In the yellow box here, we do realize we will need to do a little bit of work to see where we can grow capacity and infrastructure to do more of the future type of work that we might want to do in research and innovation in kidney disease. There were some things that you might have seen on the illustration there, around, research that spans across clinics, be it trials, quantitative or qualitative studies. We feel like there's probably more we could be doing across centers and then developing some structure, supports, infrastructure to be able to do that kind of work and sustain it. And then we'll need to think about the last thing here in the green box on the right is, how do we really support this and develop some further structures to support it and oversee it. This could come just out of opportunities of people on this call who see potential in this network and want to, bring forward ideas and figure out how we can seek funding and implement initiatives or projects across this network. We're very open to that, or even developing, working together to kind of develop a coordinated strategy of how we move forward. We're thinking on both levels and interested in trying to see how we can make that happen in the coming year. So we'll move to the next slide here. this is what we want to do to wrap up. We have this planning and dissemination grant, as Selina mentioned at the top, and we kind of want to package up that aspect of things and position us to move to the next stage. So we are here on the first bubble. We're just presenting back to everybody. We know everybody can't attend the World Café event, so we want to try to share this information as much as possible with everybody. We'll make it accessible in a report. We have to report back to CHR, but we'll also report back, share our report on all activities. And we plan to publish this as some sort of manuscript so it's publicly accessible and can be used by everybody in the future, particularly where there's things that fit into work people want to do. And then we kind of like to move forward with a group that would work around more, designing how the network moves forward and starts to operationalize some of these ideas. So we're going to be looking in the new year for people who are interested in contributing to a working group, or I think that's what WG stands for, right, Selina? And our design team who's kind of wants to kind of start talking how we move these ideas into action going forward. We probably will make our public presence a little more clear of what we are, like by revamping some of our public facing things like a website. And this would really kind of start with reflecting, what we see the objectives and future of the network are from these types of events. And then we know from that, we think we can explore funding, grants, projects that individuals want to do across the network, or things that grow out of this working group. Again, I think this could come from collectively developed, or individuals could come into the network with ideas and have a place to share them and find like-minded people who want to work together. So those are some of the things we will do, and we're very interested in having people connect and come forward with interest if you want to be participating in any of the work going forward, or have ideas how this network could evolve. So I'm gonna then see if there's any discussion or questions or comments. Please do give your thoughts. I think we'd be interested in hearing, as we've tried to summarize what we heard from the people who were at the World Café. But do the things that we've presented today resonate with your experience or thoughts for this network? Do you think there's anything missing that you'd just like to bring forward and make sure we've captured? That would be great. And then other thoughts people want to share on where do we go from here together as a group of people who are interested in research and innovation in kidney care for chronic kidney disease in Canada. So we'll open it up to some discussion, and I'm great to see David. You've jumped up with a hand already, so take it away, get us started. Let's
Thanks,
see
Matt.
what people's thoughts
Thanks,
are. Yeah.
Thanks, Lena. No need to be shy here. So I think this is very excited work, and I think the alignment and priorities reflect what, if I was there, what I would want to see. And the things that I think are most important, I think we all work in different, and I've worked in multiple provinces, right? So I've worked in multiple CKD clinics, and the focus on educational materials and co-designed elements for patients and caregivers, there's a big difference across provinces. And I think I always pull from BC Renal C or ORN for different resources. And I think that educational development and standardizing across is very, very important from a clinical care delivery. And I think the with the lens that everything should be done with patient partners and caregivers to align with priorities. I think we've all learned throughout Cancel CKD and SPORE. I think the one thing I want to highlight too is there is great research going on in this area led by Canadians, and I think we need to play to our strengths. And I'll just highlight Annie-Claire Nadeau-Fredette's work in transitions from CKD to dialysis, including home dialysis and in-center dialysis, focusing on physical function, quality of life. Nav Tangri's work on frailty transitions, Same with Stephanie Thompson. I'm doing stuff about uremic symptom transitions, etc. So a lot of us have CHR funded studies in this area, and there's research infrastructure there that we're leveraging through relationships, but I don't know how much it's standardized through this network. I know we've all gotten letters of support and all those other things mentioned before, but I think there's really an appetite here with these multi-center cohort studies ongoing in the area.
Thanks, Dave. That's really great. On that first, so two really good ideas there. On that first one around the resources that differ across the province and maybe provinces and potential to share more. Any ideas on how this network could operationalize that? Like what would bring that more to fruition? How do we would we really effectively do that better job of that?
I'm not sure if like an environmental scan has been done about what's available for across those different pillars, whether it's in education, about
Mm,
home dialysis or transplant or symptom management or cognition or polypharmacy, safe like medication guidance, all those types of things. Maybe that's a starting point to see what else is available out there. Like I know what we have and what we don't have and what I've used in other jurisdictions too, but I don't know how much that's across the board. I think people just find their favorite resources and just use them and then kind of share them around, but I don't think it's been formalized.
yeah. Okay, thanks. I mean, I think back in the one of the origins of the CKD Clinic Network, I think there was an environmental scan done particularly around modality education, that aspect was done, but that's several years ago. So I think there's a lot more awareness of symptom and patient-reported outcome measures and other features perhaps than there was at the time. So there may be some updating things that could be done there. Monica, it's over to you.
Yeah, I really like the discussion, and just I've been reflecting a lot on how do we do that with respect to the materials. And I don't think it's going to be the CKD network creates the materials, but I think what we could get to in Canada is a bit of almost a culture MOU that, oh, ORN is working on this and they're really good and everyone's using the same principles to create with the appropriate patient partners and lenses. We're going to wait on that, and we'll have the timeline of, oh, that's going to be coming out and we're aware it's coming out, and so therefore we're not going to start it but we're going to use our resources at BC Renal to do the part on this, because we have a group of individuals and we know that ORN is going to scale and spread that as well, and they're not going to work on that. We know that Alberta is doing primary care resources, and so we're just going to hold on that because we trust, and we'll have a few people that are going into that. And so we all use the resources that we've already um, got throughout the country to help work on areas where we have areas of expertise, and then we can do so much more versus all of us trying to, there's a conservative care coming out of here, then we're going to be waiting on that and adding our lens. So to me, the community can help with that, so we can just be aware of who's doing what timelines, and share. So
Yeah, I don't think anything exists like that, does it? Like where you kind of got a collection or a library of like what resources exist. There was something like this in CanNet years ago, but that's totally out of date now, I think. But maybe that's something we can do. We can be a place where everything is shared and you can see and have some spotlight on what's being developed elsewhere. We don't need to reinvent the wheel, or if you're developing and tailoring something for your province, you can see what other provinces have done and learn from that. So that seems like a nice fit. Barry, over to you.
Hi, it's actually David, but my computer decided to go with my surname first, but
Okay.
that worked. It works. Doesn't matter. I've been called worse. So I'm going to swim a little bit upstream here a little bit. There's been a lot of mention about standardizing X, Y, and Z, and a lot of it is at the tactical level, at least as far as I've heard. Now, there may be a lot below, more of the iceberg below that I'm not privy to. But one of the strengths and one of the challenges, and this is kind of reflected in your World Café approach in the first place, is the diversity across the country and even within provinces. And this is one of the things that makes the research so very difficult to how we provide care and what's the cost of providing care and what's the carbon footprint of care, because everybody's just so darn different. So creating kind of standard models may not be necessarily the best objective, but you could use something more ubiquitous. And then similar to comments that were made before, implying kind of creating a catalog of different models and solutions to fit certain things so that each program can kind of pick what works for them, perhaps from two different programs that have similarities, and then they can amalgamate it. And then what they do can add back into the catalog, because it won't work exactly. So, for example, in Ontario, being in Sault Ste. Marie, Northern Ontario, my needs are going to be very different, and my literature even is going to be different than, say, what's needed in Toronto or London. And similarly, Thunder Bay, which has a different model and services a lot more flying communities than I do, will have different needs in that. So to try and make a standard model, I think, is going to be frustrating and it won't work. But try and create and say, what are the CKD clinics like? Going right back to the fundamentals. I know this sounds very boring, but if you don't get the fundamentals, that foundation, everything else is a straw house that you build on it. So what is the mission? What is the just cause, to use Simon Sinek's words, of a CKD clinic? For our clinic, it's to help create a healthy community for all peoples, capital P. That's how our program is. That's our just cause for our program, and we make all decisions pointed at that. And that helps also clarify when you get conflicting things, because there's always conflicting things when you make columns of, different objectives and stuff. I even see this in our hospital. There's going to be conflicts between, usually it comes with conflicts with clinical care and economics, right? Sustainability and clinical care, they always seem to butt heads. But you need to always, when you do that, you always have to have that layer on the top, that guiding principle, that North Star vision, whatever you want to call it, just cause, that will allow you to reconcile the conflict at the lower level, and it'll help you make that choice. To kind of use a science fiction element, it's kind of like the zeroth law of robotics versus the first, second, third. If anybody knows Asimov, you'll know what that means. If you don't, never mind, it'll take too long to explain. But the principle being, you have, by having that here, you can actually fix problems down here because it clarifies it a little bit. So that's just my thoughts. I mean, some of the research I've been doing recently, looking at rural and remote patients, this is one of the things that comes out in the literature over and over again. It's just too hard to be precise because it's so variable. So you have to become practical about it and say, okay, well, rather than taking the time to try and have a high accuracy, we have to focus also on relevancy and timeliness, and use those three parameters from a superiority, from an information superiority perspective, to get the best we can, and then go from there.
Yeah, thanks a lot for that. I think just a few things that struck me there and from what you said is we have a common North Star guiding principles, but we have to we don't want to standardize everything across all of Canada. That's not our goal. We need to respect the diversity, the needs of different programs, of different places, of different peoples. We probably have some common goals, but our objective is not to produce rigid guidelines or standardization. It's really just to create what each person program across this country might need.
We are in our last 4 minutes, so anyone else that hasn't contributed but wants to, oh, that's nice. Yeah, well, we can kind of see each other, our black boxes. Any other closing thoughts? Anything else?
I will
Go
speak,
ahead.
sorry, Monica and Selina, on behalf of all three of us. I hope you agree with this, but I think we'd all interested in hearing any other feedback. You know, if you want to reach out to us through email or have a call, just let us know. Selina is the best person to respond in a timely manner, but feel free to share more with us offline if you'd like to. We're still have an opportunity to take in feedback and ideas. So um, Zoom is not a perfect medium for this. So reach out in any other ways if you have additional things you'd like to say. And Kathy, before we end, over to you.
Hi, everyone. As a patient partner, I just want to congratulate. I really enjoyed this session and I enjoyed all of the follow-up and everything in terms of as we keep moving forward. And I really think that whole idea of patient-centered care really came in the diversity, that we spoke greatly to that. And I appreciate the efforts in terms of that. And I hope that we continue to, and you continue to involve patients. And from a First Nations Indigenous perspective, that a whole idea of the sharing of knowledge and the collaboration is something that we really need to do because of the fact we want to do what's best for the patients, and having them involved is just so important as we keep moving forward. So kudos to everything. I thoroughly enjoyed the session, and hats off to Selina and Mila, did a tremendous job. So thank you. Miigwech.
Thanks, Kathy. I think your words are the perfect way to wrap this up. So I think we'll wrap things up. Okay, Monica, are we? Do you think? Yeah.
Thanks, everybody. Have a good rest of the day.